Welcome everyone. Thank you for joining us for our first Region 11's monthly webinar series. My name is Erica Ricario Thorpe and I am part of the chapter relations team at HFMA. To kick off the webinar, we would like to thank our sponsors, AmPlus, Commerce Healthcare, Progressive Management Systems, Parallon, Firm, TCF Capital Solutions, Harris & Harris, Extend Healthcare, Access One, HRG, AccuReg, Novus, Mail My Statements, Borlart, Premier, Centauri, TrueBridge, Avidyne Health, Patient Matters, Argos Health, RMC, Enable Comp, State, Sherlock, Aid Bailey, Softtech, OVAG International, and Vitalware. Your participation is requested. There will be live Q&A during the webinar, so put your questions in the Q&A pod. We'll also be utilizing the chat pod to share information and tips during your session. We also will be having live polling, so please make sure to participate. And now it is my pleasure to introduce Ramona Hernandez, RE2 for Region 11.
Hello, everybody. Thanks for joining. I hope you can see me here. I have the pleasure of introducing our speaker today, and just want to say a quick thank you to the association for helping us host this regional webinar. We have another, and again, thank you to all the sponsors for the Western Symposium. So I'd like to talk to you a little bit about what we're going to, a little bit about HFMA and who we are. So, you know, HFMA is an association representing 50,000 leaders in healthcare, finance, clinical medicine, and the health plan. We take pride in bringing professionals together across the United States to collaborate and deliver real value. So our mission is to lead the financial management in healthcare. So some of the benefits I wanted to share with you today, as if you, and hopefully you've experienced some of these benefits, and if not, please go out and look. And I'm gonna just list a few, so just bear with me. So, we take pride in being the industry of intelligence. So, and what that means is you won't get caught by surprise with, with customized content. HFMA delivers daily newsletters delivering essential industry updates and relevant news. We do regulatory assessments and policy interpretations. This will save you time and frustration. We do a lot of collaboration, interactive with the community. So if you haven't gone to our website, we've built a community on the website that will build your network, share experiences, get insight, and tap into expertise from others who face the same challenges throughout the online community groups. So some of the benefits with education and certification, these will, the members, if you're a member, the members receive unlimited access to webinars, online e-learning that includes Promote Yourself courses, business and healthcare online programs, patient access, and patient financial communications program. The certifications have expanded. So here's a list of some of the certifications that you can receive that's all inclusive in your membership, which is the CRCR, CHFP, CSBI, CSPPM, CSMC, and CSAF. So these are the certifications that are included in your membership. So along with being part of the region and a member of the region or a member of HFMA, these are the resources that you have, and we wanted to give this to you. So after today's session, you'll receive this deck, and you will have these resources at your fingertips. So again, this is the websites for you to reference to. So these are the chapters that share within the HFMA region. So you have Northern California, Southern California, Washington, Alaska chapter, Hawaii, Oregon, Nevada, and San Diego Imperial Chapter. So I just want to say thank you again to all of these chapters for collaborating and bringing these webinars to you. Now I get the pleasure of introducing our speaker, Paola Turchi. She's with Allscripts. Paula's been with the revenue cycle space for over 15 years. She's a certified professional coder. She has her CHFP. She has her AAPC. She has certification in MGMA. Paula has a green belt and Six Sigma certificate from the University of California and change leadership from Cornell University. She's provided consulting services to over 250 practices, ranging from one doctor specialty to 1,200 physician IDNs. Paula's also spoken MGMA and national and HFMA regional conferences. So without further ado, I'd like to give you Paula.
Thank you so much, Ramona. Okay, so for today, we have a few learning objectives. We want to make sure that we review the key performance indicators and compare your organization against the industry standards. We are going to be evaluating your revenue cycle process and kind of like trying to identify key performance opportunities. And then we are going to leverage the process improvement tools to implement enhanced processes. So kind of like talk about KPIs, how the workflows will be evaluated, and how we can implement change. But before we actually start, I would like to know who we have in the audience. So let's go ahead and identify it from a survey standpoint. Who do we have? Whether you represent 1 to 25 physician medical practice or 26 to 50 and so forth. And we can go ahead and perhaps use the chat to answer this question. Give you a couple of minutes here and there. All right, so we are seeing quite a bit of hospital and or ambulatory surgery center, and then some medical practices of various sizes. Very good. Okay, a little bit of everything. A lot of physician groups. That's fantastic. Okay, let's go to our second question. Now, what level or what role best represents you in the organization? Whether you are a physician or a C-level executive, VP, manager, supervisor, hands-on person. We get a lot of VP, hands-on. Okay, very good. A C-level. Does not look like we have any physicians. Okay, VP and director level. Very good. Okay, well, so let's get started. We first are going to talk of how to measure the health of your revenue cycle, and we're going to split it into components. One is the key performance indicators, and then we're going to talk about other metrics that will be important for you to review for your revenue cycle. When we're talking about key performance indicators, we're talking about productivity trending, the gross and net collection rate, the days in AR, the payer mix, open balances, the ATVs, denial rates, and the clean claim rates as well. So let's start with the productivity trending. Here is the opportunity for the practice to evaluate over the past 12 months how they are doing with their charges, the payments, their adjustments, and their refunds, right? You will be able to identify how you are performing during this particular month and kind of like compare yourself with the previous month. Also, what kind of encounter volumes you are seeing, what is your charge per encounter and your payment per encounter, as well as your gross collection rate and net collection rate. This will be a great startup or dashboard to show you everything that's going on in the organization in one spot. Now, you can break this by physician, by business line, by location, so it allows you to see how you are performing. important also to trend it, right? So you can see in a graphical mode how you are doing with these particular areas. Now, when we're talking about gross collection rate and net collection rate. So from a gross collection rate itself, we're talking about the total payments recorded as a percentage of your charges. The goal, 30%, but the reality is that it really depends. It all depends of what your markup is on your fee schedule. You need to make sure that, for example, if your fee schedule happens to be 2 times Medicare, you should be expecting somewhere about 50% of a collection rate. So it will be greater than 50% versus greater than 30%. So just keep that in mind. The other thing that we are talking about, or that is important to take into account when we're talking about collection rates, is your contractual adjustments, especially when we're talking about net collection rate, which represents the percentage of total possible revenue collected. So what is it that you are collecting that you should be collecting, right? And the key here is that you do not include your non-contractual adjustments in these calculations. So as you can see, the formula is payment minus refunds divided over charges minus contractual adjustments. So make sure that these contractual adjustments really are the CO45, kind of like reimbursement comment only, versus including things that have been denied for timely filing or because there is no authorization on file, things of that nature, because they will kind of like overstate your collection rate, when in reality you are collecting less than what you should be collecting. So gross collection rate and net collection rate, good key performance indicators for you to keep in track. The next thing that we have has to do with your days in AR. So from a days in AR standpoint, we're looking at how long it's taking for you to get paid. That's the total AR divided by the average daily charge. So when we're talking about what should be the goal of collecting of the days in AR, the answer is it really depends. And the reason why we say that is because it really depends on what your payer mix is. If we're talking about a best practice kind of like standpoint, from an MGMA standpoint, we're looking about 30 days and then 45 days for a urology practice, for example. However, all of this is really dependent upon your payer mix. If you have payers that take, like workman's comp, for example, could take 3 to 6 months to get paid, well, your days in AR is going to be a little larger than if you happen to have Medicare or Blue Cross Blue Shield. When we're talking about having, in this instance, almost 40% of your practice being Medicare, and then a large percentage also being Blue Cross, knowing that these payers are paying you within 10 to 21 days, you could actually have a very good days in AR, probably below the 25 range, right, because of your payer mix. But like I said, if you're heavy on workman's comp, if you're heavy on third-party liability, or sometimes it takes a full year for you to get paid, that is going to change what your days in AR should be. Now, don't forget to also keep a trend. Trending how you are doing your days in AR will be very beneficial for you to see what is going on with the organization. Okay, the next thing that we have to do from a key performance indicators to see how you are doing in your AR is to see where the money is. Kind of like reviewing the top 10 of everything. So give me the top 10 insurance companies that have balances outstanding for over 90 days and what that percentage is. What is the balance? What is the charge? And how many claims do I have outstanding for this particular insurance? Once you start identifying that, for example, insurance number 7, 63% of that is over 90, start digging deeper, right? Identifying why that might be. Let's look at providers. Maybe it's because of a specific provider. Maybe it's a surgeon. Maybe it's a family practitioner. Also, dig deeper and identify if it's a specific location. Maybe you're having problems with a nursing home. Maybe you're having problems in the dialysis unit or in the office or in a specific hospital, whether it's inpatient or outpatient. So try to split this by the insurance, the provider, the location, and then dig deeper and look at the procedure code. Which are the procedure codes that are getting denied the most, or perhaps that still have outstanding balances over the 90 days. These open balances and the review of what's outstanding in your accounts receivable is a great opportunity for you during this COVID pandemic if you have low volumes and you're trying to catch up and capture as much revenue as possible, this will be a great area to really optimize and identify, okay, what do I have from an AR standpoint? What if this is collectible? Can I clean it up? Let's have a special project for it. Now, needless to say, when we're talking about AR over 120, we want to have the least amount of claims outstanding past this 120 mark. When we're talking about best practice standpoint, anywhere between the 8 from a best practice and 18% over 120, okay? Now, another thing to keep in mind is the importance of re-aging the aging buckets. What do I mean by that? Historically, we have started doing the follow-up of the claims after 45 days, right? So you submitted a claim, you waited a little bit for your payment, it got posted, and usually the claim did not get paid by 45 days is when you were started making the phone calls. However, we need to think a little bit differently in here, in the sense that a lot of insurances are paying much faster. If we're talking about Aetna, Cigna, Blue Cross, Blue Shield, they're paying within 14 days. If we're talking about Medicare, 14 to 21, Medicaid, 30 to 35, Workman's Comp, 45 plus. So instead of having aging buckets that go 0 to 30, 31 to 60, and so forth, try to have brackets that are actually faster in the rev cycle, so a little sooner from submitting the claim. So that way you're able to collect much faster for your dollars. Because the reality is that the longer that we wait to collect, the less likely you are to collect. So I'm going to have a question here from a poll perspective and find out, when are you actually submitting or starting to work on your claims? Let's see if we have after 30 or after 45, but if you really are making it dependent upon when your insurances are paying you. Or if you have any other method. Okay, let's see what we get. Okay. Let me see what kind of results we're getting. Can we see the results, Erica?
Yes, I apologize about that. I don't think that I can send them out to you, but I can see that 30% are after 30 days. After 45 days, it's 22%, and 33% is depends on payers, or groups based on how quickly they pay the practice, and 15% is other.
Very good. Yeah, I see it. It popped out on the screen. Okay. So there you go. So for almost like 50% of the attendees today, think about start to follow up on your claims a little faster, knowing that some of your payers might already be paying you within 7 to 14 days or even 21 days. Very good. Thank you, Erica. Okay, moving on. The next thing to keep in track when we're talking about the key performance indicators or the pulse of your AR is denial management. We want to identify what is your denial rate, okay? And compare yourself against your peers, perhaps in the state, perhaps at the national level, all based on taxonomy codes. So you are comparing orthopedics with orthopedics and not family practice. And from a goal standpoint, we're looking at anything that is about 5%, right? So 5% denial rate is what we consider best practice from an industry standard standpoint, and try to trend it. How are you doing your denial rate? Are you improving? When you are actually implementing new processes, are you seeing the results? Also identify why your claims are being denied, right? So what procedure codes are the ones that are being denied, and what reasons are the ones that are being given to you for those procedures to be denied? This is another great area if you have low volumes right now due to COVID and you're trying to squeeze every dollar out of your revenue cycle. is to really look at your denial trends, identifying why your claims are being denied, and then putting processes in place to avoid those denials moving forward. Also, look at what kind of insurances are the ones that are denying your claims, and try to break it down, right? Try to see, okay, these are the denials that I'm getting, these are the reasons to why that is, this is the number of claims that are being denied, and the dollars associated with it. And if you can categorize it to the different areas within the revenue cycle, that's even better. That way you can identify, for example, that 50% of your denials happen to be because of front desk errors per se, and because eligibility or because of demographic accuracy. So that way you can focus your training to these particular individuals to do better moving forward. Now, let's have another poll so we have the audience participate. Do you have a denial management tool today that you utilize to support this denial management? Let's see what we have. And while we're waiting for the results, we got a question as to whether or not you will have the slides available after the webinar. The answer to that will be yes. So if you have any more questions, feel free to send them, and I will be looking at them as we go through the presentation. Look at that. Okay, 64% we have, yes, you have a denial management tool. 32% say no, and then we have in the process of getting one. That's very, very good. So important to have a tool that will help you identify why your claims are getting denied. Something that you can measure, so then you can go back and put processes in place to avoid those denials moving forward. The other thing to keep in mind is to have a clean claim ratio. So what I mean by that is to make sure that all your claims that are going out the door are actually clean for them to get paid. We want to make sure that you have all of your scrubbers in place, that you have your rules engine in your systems identifying when a procedure code needs to be modified or a modifier needs to be added for a particular insurance. A perfect example are the radiology procedure codes. Some insurances want one line with modifier 50. Other insurances want the two procedure codes with the right and the left modifiers. So all of those things could be configured in your systems to help you update the claims as needed before they go out, so you have a clean claim to begin with, and reduce the chances of your claims being rejected on the first pass. Next thing, let's look at other metrics. So this is what I call the no-bueno slide, okay? And a great opportunity for you to also look at during this COVID situation, right? We're trying to squeeze every dollar. Look at every claim that has been at adjusted percent, 100% adjusted off. So if the charges equal the adjustments, something has happened. Most likely, there is a configuration issue in your system, and the system is erroneously adjusting off some of these charges. So it's good to have a report that you're able to audit to track this. The other thing is anything that got paid at 100%. If you got paid at 100%, you're probably not charging enough, okay? So you want to make sure that you have some sort of a markup between your fee schedules and your reimbursement, because nobody pays you at 100% nowadays. And the other thing to look at is an underpaid. So having all your contracts loaded into the system, verifying that you are getting paid according to your contracts, because if the allowable does not equal the contract, that should be something that should be going into a queue for team members to follow up for all these underpayments. Even if it's a small amount with high volumes really means something for the organization. And this is the time for us to collect every single dollar that we have available to us. So let's go with another poll and see how many people in the audience have contracts loaded in the system, and whether or not they're checking the accuracy of their payments. Okay. Yes, 42%. We track the payment across the outside of practice management system. 13. 21 went to financial premises. We post payments. Okay. This is a very common response that I get a lot when I'm doing consultative engagements, is that our staff members know what they should be, what the organization should be getting paid. This was very was commonly utilized when a lot of the payments were being posted manually, because as you were posting the payments, you were able to identify, hey, this looks fishy. This does not look like the right amount. But when a lot of this is actually being posted electronically, you might be missing some of those. So keep that in mind. And then 25% not tracking underpayments. So this is a great opportunity for you guys to really squeeze every dollar of what you should be getting paid. So consider looking at your contracts, your allowables, or even running an audit report once a month if you don't have the tools to do that, just to see and make sure that your payers are paying you accordingly to the contract. Next thing that we have has to do with encounter tracking. So this is another area to look in your revenue cycle for any potential revenue leakage. When we're talking about missing surgeries. So of course, if you are scheduling the surgery, that is something that you can track very easily through the encounter tracking report in your practice management systems. But if these are on-call services, one of the things to perhaps consider is to creating a custom report that shows you everything that has a post-op visit that is not married to a surgery. That could be an indicator that you are actually missing a surgery. The other thing to keep in mind is the hospital rounds. So a report that tracks all of the different hospital rounds by day and identify if there are any gaps. So for example, if you saw Oscar on Monday, Tuesday, Wednesday, and Friday, we are missing Thursday. Where is Thursday? Maybe the physician did not see the patient, or maybe the charge is somewhere in the card or the code or whatever happens to be. So having reports that allow you to track on-call services will be another area to identify additional benefits or potential revenue leakage. This is another area during these times of pandemic and perhaps low volumes. Encounter tracking is something that is done as time allows, and back in the day, we just didn't have time to do this kind of tracking. So this will be a good time to catch up and keep up to date with what's going on all of the different encounters, making sure that they have been charged. Another thing to look at is E&M. So E&M trending. So what is your bell curve? How do you compare with others in the industry? Is there any potential for you to get any kind of an audit? So having these metrics will be helpful for the organization to identify where the physicians are, and even to compare physicians within the organization, just to see which ones happen to be a little shy of perhaps charging a 99214 versus a 99213. But if the documentation supports it, then they should be really charging what they have documented or provided, for that matter. Okay, so before I move on to the next section, which is how to review the workflows themselves and provide some tips as to how to gather the information from the end users, let me just ask, and perhaps we can use the chat section for this, what other key performance indicator is your organization tracking that we have not discussed? Just to see if we can share with others attending. What is it that everybody else is using that we have not brought it up? Let's see. There's some more, okay. 30%. And in the chat section, we'll be able to see what those reports are. Okay, let's see. Okay. I don't see anyone posting anything on the chat yet for what other applicable reports you are running, but just go ahead and feel free to add them as as you get the chance, so we can all learn from each other as to what else you are actually reviewing that we have not discussed. Okay. Moving on to the next thing has to do with evaluating your workflow. So when I am going on site and doing these kind of assessments, they're kind of like split into components. One is the initial discovery and the other one is the workflow observation. And it's important to take the two apart, or these two particular steps, because you will be surprised when you're doing the initial discovery and you're talking to the end users. You'll be surprised of how different it is, what they are telling you versus what they are actually doing, right? So having these two sections themselves are very important. So when we're talking about the initial discovery, the first thing that we need to do is really engage the management team and understand what they think the process is. What are their objectives? What are their goals of their process? How do they measure the success of the process? How often do they measure it? And then what kind of communications do they have with the team to provide feedback about what they have identified? What key performance indicators they are tracking? And also what pain points do they have in the process? What they wish the process to be. My favorite question to ask is like, if you had a magic wand, what would you want to have in your process? What kind of tools would you like to have in place? This will give you an initial idea of what's going on in the organization and what kind of processes they have in place. Then go to the staff members and go into more detail. So how does the process start? What triggers the process to start? How does it go from point A to point B? When do you know that the process is complete and you are now able to do your part, for example? Where do you spend most of your time and why is that? Other questions to ask would be what do you feel you're repeating over and over again, and how often are you doing this, and why are you doing this? What parts of this process will be unnecessary or you deem to be unnecessary? This is a great time for you to start getting their buy-in and their feedback. They have a lot of valuable information about what happens in the floor that could be improved, and they could be the ones providing the options and the opportunities, and they will buy in whatever new will be implemented. Also, this is a very key question, and it is, when pressed for time, what steps in the process do you skip or work around? Or if pressed for time, what do you not do at all, right? This happens a lot when we have jacks of all trades. Especially in the billing office, in small offices, a lot of the things that happens is that you have a person that is doing the charge entry, the payment posting, the AR follow-up, the self-pay collections, and what normally happens, they do charge entry, payment posting, and they don't do the follow-up because they don't have time to do so. So identifying the steps and the processes that they are not following up when they don't have time will be very important for you. And the other thing, what kind of pains they have and what kind of suggestions they have to move forward. Now, once you have the idea of what's going on with the organization, what kind of processes you have in place, you're already picking up what kind of opportunities there might be. But when we're doing the workflow observations, one tip that I would give you is that ask them to show you. If you tell them, hey, tell me how do you do registrations, tell me how do you do scheduling, they know a lot of times what to say, but that's not necessarily what they are doing. So ask them to show you how they're actually performing the task. When we're talking about scheduling, things that we want to have at the bare minimum is to have accuracy in the demographic data. We want them to be using the templates versus them trying to find out when this appointment should fit. The system should tell them when the appointment should fit. Also, insurance verification. We're going to have a lot of eligibility denials during this time when a lot of patients are losing their job, they're losing their coverage. So eligibility verification is becoming a very, very important task during this time to identify who is going to be responsible for this service. And then notifying the patient that they have an outstanding balance and we expect them to pay at the time of service. From a privacy standpoint, of course, we want to have appointment reminders that they are by text, email, phone calls, so all of the different ways that the patients might prefer to communicate with you should be considered. Also, we're talking about eligibility and benefit verification, prior authorization management. So any way that you can automate this process will be ideal. Hopefully you have triggers that send them to a queue based on insurance, based on the service or appointment type that is going to be provided. You know that an authorization is needed, and then a queue is populated, and the end users are able to work out of this queue versus leaving it up to the end user in their mind and their knowledge to identify whether or not a referral or an authorization is needed. Also doing estimations for out-of-pocket expenses. We want to make sure that the patients know upfront what they will be responsible for and when they're expected to pay. And mobile check-in capabilities. I have seen that a lot of practices are implementing mobile check-in because of COVID. They don't want to have this face-to-face check-in process. So mobile check-in is being adopted more and more, but is something that definitely will be ideal if everybody has it. Then from a front desk standpoint, we're talking about something went down the wrong pipe. Okay. From a front desk standpoint, we're talking about demographic verification, real-time eligibility, scanning your insurance cards, collecting a demo service, and then having a program from a credit card on file. That way, when the insurance processes the claim, you have the information from the patient to be able to process the patient's responsibility. Next thing, from a coding, charge capture, and charge entry. Want to make sure you have all the documentation in place, that you're auditing and making sure that they are documenting what should be billed, that you keep a close look in the coding lag, right? So making sure that it's not taking 2, 3, 4, 5 days to code for these services. And that information is being sent back to the physicians, that feedback is sending back to the physicians to be able to train them so that way they can code better. Also charge capture. So hospital services, satellite locations, those are perhaps the hardest ones to keep track of. So any kind of mobile devices that you can implement at your practice to capture all of the services automatically versus depending upon pieces of paper that are being brought back to the practice will be ideal. In-office services, using your encounter tracking report and making sure that you have charge reconciliation. And then from a charge entry standpoint, the biggest component that I want to highlight has to do with automated edits. So once again, if you're able to configure things in your system that identified when a claim might get denied because it's not meeting the requirements that you have with your payers, having that being configured in the system so the system can do it for you versus depending upon the end users to change the claims manually so the claims can go out will be ideal for you. And then when we're talking about workflow observations from a billing and payment processing standpoint, you want to make sure that you're submitting your claims and statements on a daily basis. Specifically statements. I think insurances is more common to submit daily, but patient statements, I've seen a lot of weekly, sometimes bi-weekly or monthly of submissions. So daily submissions would be recommended. The reason for that is because as you are submitting your statements daily, you are spreading out the volume of phone calls and also you are allowing the payments to come in throughout the week versus having gaps from payments coming in. Making sure that all the claims have been received by the clearinghouse, that there is scrubbing in place, and that all of this, anything that is outstanding goes into a queue. So there is no report that you have to work from, but a queue that you have to work from. Payment posting, mostly ERAs, that you're posting your $0 EOBs, that any auto adjustments are happening versus having to manually adjust things. And I'm referring a lot to capitation. I have a lot of practices that are manually adjusting every capitation charge. That is very time consuming, and keeping track of underpayments. From a refund standpoint, things to look at, that you have automatic queues, that you are being proactive versus reactive, you have some sort of integration with your AP system, accounts payable system, and that you're able to refund your patients on their credit cards versus having to issue checks. It's a little bit more efficient. From a follow-up standpoint and denial management, a lot of process automation. So making sure that everything goes into a queue in an automated way. I have practices that actually print aging reports and work from an aging report for 30 days and then print a new one the following month. Practice management systems today are very robust. You should be able to have queues in the system that would allow you to track these claims. Also having a credit card on file for your self-pay patients and automatic monthly deductions. This is another area that a lot of practices are still trying to get up to speed and is being able to have these payment plans or budget plans being automated. So that means that the patient has decided they want to pay $50 a month, they want to have the credit card on file, and the system is automatically deducting this $50 from their bank account. Versus having, which I have seen, an accordion file that has it by day. You have the credit card information in each day, and then each day an individual pulls the information and actually charges the credit card. One is not compliant, and two is not efficient. So I'm trying to automate this process will be the best way to proceed. Once again, timely follow-up with insurance follow-up. So if you have payers that are paying you within 14 days, there is no reason to wait 30 days or 45 days to start this process. Keep that in mind. And from a denial standpoint, we want to make sure that you are trending your denials, identifying what you are getting paid, that you have alerts. So what I mean by that is that if, for example, you are expecting a 5% denial rate with Blue Cross Blue Shield, you know that that's their norm, you don't want to continue seeing this 5% over and over in your dashboard. You want to get an alert that says, hey, by the way, it is at 8% now, or it is at 6% now, versus looking at the 5% over and over again. You want the system to work for you versus you having to go and look for the data. When we're talking about reporting, things to consider and keep in mind from an optimization standpoint is having practice productivity by location, specialty provider, RVU reporting. Also very important, staff productivity. How many claims are they touching? What kind of claims are they touching? Is it an appeal or is it a rebill? Insurance productivity standpoint, contract adherence, denial trends, days in AR, aging, and compare the insurances. How are they actually performing? Industry standards, so the HFMA, key maps, or MGMA, or any other professional association based on your specialty will be a great source for you to get any kind of benchmarking and compare yourself with others as to how you are doing. Actionable reporting and alerts, and then access to the dashboards. All of that broken down by the different combination of things that you might imagine, right? By location, by insurance, and so forth. And the goal is to have minimal data manipulation. So when you are having a report, you're having a dashboard, the idea is not that you're having to extract the data from the practice management system, go into Excel, try to change the information, and come up with a dashboard. Now, I wanna have a poll question right now and see if how are end users performing or tracking these key performance indicators. I don't know if they're using the practice management system or a third-party analytics vendor, or you're exporting into Excel and manipulating the data. Let's see what we have. Okay, so practice management is the majority. Third party, Excel, 30%. Okay. Very good. Okay, and moving on to the last part of our presentation, just giving you some tips when you are doing the workflow assessment. So watch the users in action, like I said. Usually when they are telling you what to do, sometimes it's different from what they do. Practice your poker face. If they are telling you something that is absolutely crazy, just continue and say, okay, I understand. What else do you do? If you kind of like give this like very scary face that tells them that they are doing everything wrong, they might not share more information with you. Make them feel uncomfortable so they can share more information with you. Prompt the users to show you what they are exploding or explaining. And then show them a few tricks to improve their process, but keep in mind that this is not the time to change the workflow itself. If you know that there is something that if they're doing a right click versus a left click will make their life easier, is something to show them during that discussion, but not necessarily change the workflow itself. And of course, acknowledge their concerns and get their feedback to improve the process. So you have checked your key performance indicators, you have checked your workflows, you have identified what kind of opportunities you have in place. Now it's time to implement the changes, right? So the first thing that we'll look is kind of like the define phase. So define what the problem is. What are you seeing? What do you want to see? Then here you start brainstorming about what kind of desired results you want to have in place. So, for example, you have identified that you are having a lot of denials due to eligibility. So what kind of eligibility verification threshold do you want to have? For example, 98% of patients that come in, we want to have eligibility verification for. Also, measure what is your problem today. So if you know that your problem is eligibility verification, identify what kind of denials you are getting, meaning the percentage of denials due to eligibility, or how many patients are not being checked for eligibility. So confirm that what your concern is actually valid with the data. The other thing will be to conduct surveys if you are trying to get information from the end users or from patients directly, whatever happens to be the area that you are addressing. Then analyze the results, right? Why is it that this is happening? Well, they're not checking eligibility because they don't have a tool, because it takes a lot of time, because the system does not provide what they need. So try to identify the source of the problem, the root of the problem. There are several tools that will help you to identify what that is. There is the 5 whys technique. Always ask the why. We're not checking eligibility. Why not? Well, because the system does not work. Why does it not work? Because it provides us inaccurate data, and so forth, until you get to the root of the problem. And then try to brainstorm solutions, right? Even ask the feedback from the end users as to, okay, how can we help you with this process, and identify what those solutions should be. Once you have that in place, then go ahead and improve the process. And there is this DMAIC cycle in which you can plan, do a study, and act, right? So it's like, how are we going to do it? Let's implement the change. Let's see how, evaluate those changes, see how we're doing. Do we need to make any modifications? If the answer is yes, let's make the modifications and measure all over again and make sure that we have the right plan. You start with a pilot, and once you know that that works, you go ahead and explode it to the rest of the organization. And finally, you kind of like identified how did we do. Let's celebrate. What is the final report for the executives to identify the changes and how you improve the process as a whole. So as a summary, things to keep in mind. So complete your operational assessment, benchmark the organization against key performance indicators from the industry. Also, what kind of opportunities you have in place. Establish, if not already in place, a continuous process improvement team that will help you always to get better at what you are doing. Develop the implementation plan. Make sure that all the changes and modifications are patient-friendly, absolutely. Try to automate and centralize as many processes as possible. Manual processes just open themselves for a lot of errors. And don't go at it alone, right? There is a lot of experts outside in the industry that could help you with identifying what kind of opportunities there are in the organization from a revenue cycle standpoint for you to be able to improve the bottom line. So I'm going to stop right there and see if there are any additional questions. See what we have. So we have a question. It says, throughout your presentation, you mentioned that there are a few areas we could be concentrating on while our practice volumes are down due to COVID. Could you summarize those areas for us? So absolutely. So number one, contract adherence. Make sure that your insurances are paying according to your contracts. This is also the time, if you don't have your contracts available, to pull up all of your contracts from your payers, making sure that they are uploaded into the system and running reports to identify any kind of underpayments. The other thing is denied claims, identifying why your claims are being denied and putting processes in place to avoid those denials moving forward. Another area, working on your old accounts receivable and kind of like cleaning it up. If there are timely filing requirements for claims, whether it's because for submission or from an appeal standpoint. If your claims are past those timely filing requirements, you must well get rid of it on your AR and clean it up during this time. And then we're talking about self-pay follow-up, right? You have a lot of people that are losing their coverage due to unemployment. So checking eligibility and documenting what your processes should be for collecting on uninsured or underinsured patients would be very, very helpful. Okay, let's see any other questions. Very good. So I really, really appreciate you joining the conference. Thank you so much for your time. There are, on this presentation, a lot of handouts available for you. We have all of the different metrics from an operational standpoint, accounts receivable and staffing, and then you have a lot of HFMA, great documentation for best practices for resolution of accounts, and then for financial communication for your patients. So I'm going to stop right there and see if anything else, Ramona, that you want to cover?
Yeah, thank you, Paula. That's great. I just wanted to, there's been a lot of questions and a lot of in the chat about the presentation. So the presentation is going to be put on a YouTube and be put on the HFA community. And we're also going to be sending it out to the chapter so they can post it on their websites. So you will be able to get Paula's, we recorded this live. So we again put on a YouTube and be able to be accessible to all of you. Okay, so thanks again, Paula. If you have any questions, please feel free to email Paula directly, and she's been gracious enough to agree to send you guys anything that you guys need additionally. So please look forward to our next webinar on August 19th. All of you will get a reminder if you haven't already signed up. So again, thank you very much, Paula, and everyone who attended. Have a great day.
Thank you so much. Thank you, everybody. Goodbye.